Good afternoon, everyone. This is.
It's brilliant. Now, this stupid thing again. Give me 1 second here.
In this grant program and in the work of the Tufts Health Plan Foundation, and we're very much eager to share some valuable information with you. On behalf of Nora Moreno-Cargi, the President of Tufts Health Plan Foundation and Vice President for Corporate Citizenship at Tufts Health Plan, the board of the foundation, and the entire foundation team, it's my honor to welcome all of you to the session this afternoon. With us this afternoon, you have the majority of the grant team. This team is listed on the slide on screen. You're hearing my voice. I'm at the top of the list. With me is Kimberly Blakemore, the program officer. Also on the line is Ulrey McNiff-Daniels, our Senior Communications Officer. We are all here because we're committed to partnering with so many of you and in supporting the great work that's happening in communities. And just to give you examples, while Kimberly and myself work directly with grantees throughout the process, as well as the organizations interested in the grants or working on related issues in community, Ulrey also does work with organizations, both grantees and non-grantees, to promote their work through our social media platform and to champion the issues that you're all working on. So what we'd like to do first is have Ulrey walk you through the agenda and a couple of housekeeping items, and then we've got some questions to make sure that we are maximizing the value of the hour that we're going to spend together for all of you. So Ulrey, I'll turn it over to you.
Thank you, Philip. And good afternoon to everybody. It's exciting to see we have nearly 200 people on the line, and we're expecting more to join us in the next few moments. So thank you all for your time. Our plan for this afternoon is pretty straightforward. Philip and Kimberly are going to give you an overview and give you some information about our mission and vision. We'll focus in then on the Momentum Fund so you can get some details on this great funding opportunity and how it can relate to your work. And we'll be sure to leave time for questions at the end, because it's really important for us that we are able to respond to your questions and make sure that you understand how this fits in for you. I'd like to go on to the next slide and point out that although we're saving time for questions at the end, you can send in your questions by using the chat or question box on the right side of your screen. The webinar is being recorded. The handouts are available to you in the handout section, which is also on the right side of your screen. So if you haven't already, you can download the webinar itself, the PowerPoint slides, and also a guide on how to apply. So I would encourage you to visit the handout session after the webinar. If you have any technical difficulties, and if you can hear me, then you can call 877-582-7011. If you can see the screen but not hear me, hopefully you'll be able to read that for yourself and be able to reach out to GoToWebinar. We will be sending a short survey out at the end of the webinar. It's really important that we know if we've done a good job. Have we answered your questions? Have we helped you? Please take a moment to respond to the survey and let us know how we can improve in the future. The next slide will show you the location of both the handouts and the question box. Again, we encourage you to submit questions at any point throughout the webinar. We will answer them in the moment if they are something that we need to respond to immediately, but more likely we'll save them so that we can pull all the questions together at the end of the webinar. Thank you all for your time, and we are excited to move forward.
Thank you, Ulrey. So as I mentioned earlier, what we'd like to do first is actually get a little bit more sense from all of you about your interest in today's session and your awareness about the foundation. So what we're going to do is put online a couple of brief surveys that you can respond to in real time. Will give us very much real-time feedback, and we'll share that with all of you. So the first question is asking you to describe your relationship with the foundation. So on your screen, please select one of the three options, either a current grantee if you're currently funded by us, past grantee if you have had a grant from us in the past, or new to Tufts Health Plan Foundation if, for example, you are thinking about applying to us for the first time, or if you've applied in the past but not been funded. So we're going to give a moment while folks respond, and as soon as we get a majority of respondents in, we will give you the results on screen. So thank you very much for this. We have 84% saying that you're new to Tufts Health Plan Foundation, 5% that are current grantees, and 12% that are past grantees. So actually a really helpful feedback for us that some of the information about the foundation and the way we operate and the way we approach our relationships with community is going to be valuable information to share today. The second question is one that will give us some guidance around the content, some of the content we plan to share today. We're asking you to respond to us about your familiarity, excuse me, with some concepts that you will have noticed are referred to in the grant guidelines for the Momentum Fund, and that if you've been listening to other presentations of ours in the past, you've heard us reference. So we're re-imaging the slides here, but you can now see the quick poll on your screen. And it asks, how familiar are you with age and dementia-friendly? So these are two concepts that we'll talk about shortly, momentarily, a little bit. But we'd like to know about whether you're learning about it for the first time, if you're somewhat familiar, if you're currently involved in an age or dementia-friendly effort, or if you already live in or work in a community that's age or dementia-friendly. So again, if you can select one of the four options on screen, we will tabulate the results and share with you. So thank you for the results. Again, a nice mix of responses here. 39% are already involved or in an age or dementia-friendly effort. 36% are somewhat familiar, which constitutes the majority of the folks with us so far this afternoon. 14% already live or work in an age or dementia-friendly community, and 11% are learning about it for the first time. So again, this is really helpful guidance for us as we kind of adjust to make sure that we're giving you information that hopefully you will find the most helpful. So given that there's so many that are new to the foundation, we do want to take a few moments and talk a little bit about the foundation to provide some context for the way we work, but also for the Momentum Fund, which is really the focus of today's presentation. So I'll ask Kimberly to get started about the context regarding our work, and then I'll jump back in with some information specific to the foundation.
Great, thanks, Philip. So some of you may be wondering why, as a foundation, we are so focused on aging. And we would say that's a great question. And we hope that this slide is actually giving you the information that you need to understand our focus and emphasis on older people. So as a country, we recognize that the population is aging, but in particular, the New England states are standing out in terms of the rate at which we are aging and the general bell curve of how our population is spread out across the different age ranges. So what you'll see on the left side of your slide right now is actually from the United States Census Bureau. And as we know, of course, 2020 will have an update of this information, and we expect to see some shifts again. But I don't think that actually changes anything about where trend-wise we're thinking the population will be shifting. So as you see on the left side there, in 1960, we had a pretty distinct distribution of ages, very much leaning towards the ages of 40 and below. What you see kind of going forward as we approach 2060 is really a much more even distribution across all of the ages. And we really think that that is indicative of how we as a society need to be thinking about serving all aspects and all demographics within our population. And so a couple of the states are pulled out here on the right-hand side because those are the four states in New England that Tufts Health Plan Foundation covers from a geographic standpoint. So you can see that in Connecticut, by the year 2025, 20% of the state's population will be over the age of 65. And you see very similar statistics for New Hampshire and Rhode Island. And if you live in Massachusetts, you may already be well aware of the fact that there's currently more residents over the age of 60 than under the age of 20, and that's today. So not even talking about what's going to happen in 2025 or 2030. And we have this quote at the bottom here, which is a little bit of our sense of humor too, but we saw it on a button, and we thought it was a great way to encapsulate why our focus is on aging, and that is, aging is so cool, everyone's doing it, and we simply want to be here to support communities as we think about healthy aging.
Thank you, Kimberly. So allow me to jump back in and say a little bit about our vision and mission, because as you've heard Kimberly kind of construct for you, our region in New England is aging, in many ways faster than the rest of the country, and we see that as a tremendous opportunity. We see it as an opportunity at the community level, at the societal level, and it's something that we want to be a partner and supportive of. So our vision, accordingly, is to honor and support communities working to be great places to grow up and grow old. And I want to kind of key in on a couple of phrases that are contained within that vision statement, because this really does drive all of our grant-making programs and much of the work that we engage in at the Tufts Health Plan Foundation. Honoring and supporting communities for us is at the core of everything that we do. Really, the hard and important work is being done at the community level, and we never want to lose sight of the fact that solutions, ideas, and the energy really come from community members, community residents, and organizations like yours. And then working to be great places to grow up and grow old for us is key, because there's always an opportunity to improve. Every community should find its own path to really thinking about older adults and healthy aging as an asset. And we want to be a partner in all that work so that we can help encourage it, but also share it, promote it, and celebrate it as we continue to make New England a more thriving, vibrant region that really capitalizes on its terrific opportunity represented by its aging population.
Great. So when we think about the foundation, we really know that what's in a name, right? Tufts Health Plan Foundation. And some of you, certainly those who live in Massachusetts, know that there is an insurance line called Tufts Health Plan based in Watertown, Massachusetts. It is a registered 501c3 nonprofit, the company, and through the generosity of the insurance company, they have created an endowment for Tufts Health Plan Foundation, which is a separate entity, but very much tied to the work and the focus that the insurance plan provides. As we've mentioned, the foundation is focused on healthy aging and older people, although certainly Tufts Health Plan as a business provides products and services that cover the full spectrum of ages. Here at the foundation, our team is really focused on grant making as well as leading the corporate citizenship activities for Tufts Health Plan. What this means is that you will see our employees out and about in community, whether that's here in Massachusetts, New Hampshire, Rhode Island, or now through our just newly formed joint venture in Connecticut through Care Partners of Connecticut. So you will see opportunities for our employees to be engaged in community volunteer efforts. We typically have a very large company-wide volunteer day that draws great participation from offices across all 4 states, and that is something that we look forward to continuing in the future. As we seek to move communities towards becoming more age-friendly or dementia-friendly, we find that the Tufts Health Plan employees are very supportive in thinking about ways that they could get involved too through providing grants of their own through employee match opportunities. We also have employees here who participate as board members on various nonprofits throughout the region.
So now that you've heard a little bit about the origins of the foundation, our relationship to the Tufts Health Plan, as well as our vision and mission, we think it makes sense to pivot a little bit to how we do our work. And of course, we're going to get into the details specific to the Momentum Fund in a moment, but it's important to remember that the Momentum Fund is one of the several grant programs that we offer, and that we have some guiding principles that really cut across all of those grant programs. So on screen, you'll see language that we use about the things that we prioritize and promote through our grant-making activities. We consider to be ourselves a community investor and partner, and what we really look for in community in particular, so that translates into the proposals that we review, but also into the way we organize our grant-making strategies. We look for opportunities to be able to partner with collaborative efforts. So we look for efforts that are bringing in multiple partners and that are demonstrating an impact and kind of a sense that goes beyond an individual organization and individual people that it might serve in a community. We also tend to focus and promote equity, and in particular addressing inequities. We know that all communities don't have the same level of resources, and that there are a variety of factors that affect health that may be determined through history, through economics, and through a variety of other practices that have led to disparities and inequalities. And we see that our role as a resource provider is to help communities overcome some of those disparities or inequalities, and to make sure that we don't forget that we're all trying to become better places, but that some places may not have had the opportunities that others have had along the way. Community engagement is another key factor for us. We really do think that solutions come from community. The ideas and the energy come from the community, and so we look for proposals and efforts that have engaged community in their planning and in the implementation. And then the fourth box up here for our guiding principles, policy or system impact for better outcomes, is a concept that encompasses a variety of things. For the Momentum Fund, more specifically, it comes back to the sense that proposals should do something more than just advance the activities of one specific organization that it may already be doing, but helping us understand how it's going to influence the community and make it a better place to grow up and grow old. Our role as a funder is just one of the ways that we operate in community. We see ourselves working in partnership with others as an advocate to help promote older adults and the issues and the challenges that they might face, but also the opportunities and assets that they present. We think of ourselves as a catalyst, really trying to help other organizations, for example, those that may not be thinking about older people as a core constituency, but that may already be working with them, to help them to refocus and understand the power that can be leveraged by engaging older people and thinking about them more discreetly. And also as a convener, whether it's in partnership with others or directly ourselves, we try to bring together lots of organizations and be in the room with many other organizations to share and learn.
So as we think about the work as a foundation, we typically like to think of our grant programs as falling into 4 buckets: systems and best practices, collaboration and community engagement, policy and advocacy, and the Momentum Fund. Each of these grant programs is offered once during the calendar year, but we do offer them in cycles, which means that not at any point in the calendar year are all grant programs open. So what we will focus on today, of course, is the Momentum Fund, but we did want to share with you this slide just to let you know about the other funding opportunities that the Foundation offers through its grant making. Now, as the population of older people increases, building communities that are responsive to their needs is vital. And we certainly fund programs that support individual behavior change through community-level systems and policies through our larger grant programs like systems and best practices, collaboration and community engagement, and policy and advocacy. With these 3 programs in particular, we award fewer but larger multi-year grants. And when we talk about multi-year, it can be anywhere up to 3 years of funding, and grants can range between $25,000 and $100,000 per year, and again, up to those 3 years in funding. Last year, in 2018, we introduced the Momentum Fund as a way to provide 1-year mini grants of up to $10,000 to support communities and organizations that were pursuing more early stage or more promising age and dementia-friendly efforts. And that's, of course, what we're going to dive into today. We offer each of these grant cycles these grant opportunities on a cyclical basis, as I mentioned, and what you see up on your screen now is the calendar here. The Momentum Fund only has 1 application, so there's no letter of intent that's associated with it, and that is due on September 19th. And this is a really quick turnaround time, because as you can see from this calendar, you'll receive notification of a funding decision by November 1st. We also included this slide just to highlight too that although we do offer 4 grant programs, an organization is only eligible to hold 1 active grant at a time. What this means is that if you are already a current grantee of a Systems and Best Practices grant, for example, and it is something that is still active, then you are not eligible to apply for the Momentum Fund this year. However, for example, if you are a Momentum Fund grantee from 2018, because technically it's a 1-year grant and it will be wrapped up before we make the next set of awards, you are eligible to apply for a 2nd year of funding. If you have any questions whatsoever about the status of your grant, whether it's active, whether you're eligible to apply, please don't hesitate to contact either me or Philip, and we will be happy to kind of work with you offline about your particular questions about where you are in the grant process and whether or not you're eligible for applying for a new grant. With that, I think we'll really dive into our current funding opportunity right now. Philip?
Thank you, Kimberly. So Kimberly's begun to tell you the story of how the Momentum Fund originated, in that it provides some balance for us across our grant-making programs, where we have 3 multi-year larger grant opportunities. We wanted to offer something like the Momentum Fund in direct response to questions from our board, from community members, about how earlier stage promising efforts that communities might want to undertake for themselves might find a place at the Tufts Health Plan Foundation. We underwent a process of engaging many community stakeholders to get feedback, and really the result was the Momentum Fund. So much of what you're going to hear us talk about as we talk about this grant program is really based on what we heard from community as being relevant and necessary and opportune for ensuring that communities have the ability to set a chart a course for themselves and to move concepts around age or dementia-friendly forward in their community. Now, you've heard us say age and dementia friendly already in this webinar. You probably saw it in some of the materials on our website, in particular the Momentum Fund guidelines. And so we wanted to take a quick moment just to revisit these concepts and to put them into context for you. So on the screen now, you'll see 2 images that reflect a couple of existing frameworks, one for age friendly and another for dementia friendly. The flower-shaped diagram on the lower left is the multi-petaled framework for age-friendly. This was a concept that was pioneered by the World Health Organization. In the United States, it's been adopted and championed by AARP nationally, and it provides for multiple domains that really constitute a community's capacity to be age-friendly or to be supportive and continually improving in its ability to support, welcome, and help older people thrive. On the right is a community-based model for dementia-friendly, which has a different set of origins and has domains, has capacities instead of domains that describe what communities could be doing to become more supportive of people with dementia and those that are caring for people with dementia. We understand that the models have some areas of overlap, some areas of distinction, and that they also, as we refer to them, can trigger some very specific sounding frameworks that need to be followed in a prescriptive fashion. Rather than saying that the Momentum Fund is intended to support only efforts that are aligned with these 2 frameworks, we've co-opted these terms of age and dementia friendly to say that there are many things that communities can be doing to become more age or dementia friendly. They don't have to lead to being part of a specific framework or obtaining a specific designation, but rather we think that communities can and should find their own path to improving their ability to support and help older people thrive as they age, if they experience dementia. And we know that these efforts also have benefits for multiple members of the community. So when we say age and dementia friendly, while we know that there are very robust and well accepted frameworks out there, proposals to the Momentum Fund do not have to be submitted in the context of one step towards becoming certified as dementia friendly or as an age friendly community. So as we think about this, one of the reasons why we use the terms age and dementia friendly is that we do want to continue to raise the visibility of efforts around age and dementia friendly, because it's important for all of us to continuously remember that as we all age there's a need for our communities to really reflect the needs of people across the age spectrum and to be constantly working towards improving its supports and services. To that end, in the guidelines for the Momentum Fund, you'll see on the final pages a list of resources that we thought are helpful for anyone interested in the Momentum Fund to look at to help you understand what the Age and Dementia-Friendly frameworks contain, some examples of the way they've been used, and also how you might think about them being relevant to whatever it is that you're working on in your communities. So with that context around Age and Dementia-Friendly as concepts and terms that we talk about as reference points for the Momentum Fund, let's delve a little bit more specifically into the Momentum Fund itself.
Great. So again, as Philip was just mentioning here, this opportunity was really designed to support communities as they become more age and dementia friendly, however that community is defining age friendly and dementia friendly. And recognizing that every community has its own path, we don't dictate what the activities are that we're looking for. So some communities will associate certain efforts with age or dementia friendly, while others may have a different set of initiatives or projects in mind. And what we hope is that you'll share what you're hearing from local leaders and residents and community members and help us understand the context for your work in your application. What you'll see up here on the screen are a couple of the key highlights here that you'll, again, see are reiterated in our guidelines, which are available on our website, tuftshealthplanfoundation.org. So the Momentum Fund is going to be reviewed on a state-by-state basis. So that means that in Connecticut, we'll have available $100,000 to support activities that are happening in Connecticut. Same thing in Massachusetts, in New Hampshire, and in Rhode Island, which would mean that through our mini grant program, the Momentum Fund, we as a foundation will be investing about $400,000 in early stage community level efforts. Again, these are mini grants, which we consider up to $10,000. You don't have to apply for $10,000. We often get the question, is it better for us to apply for $10,000 or $8,000 or $5,000? We, as reviewers, don't think about it from a dollar value perspective and immediately ding or put forward a particular proposal based on what it is that you're asking for dollar-wise. What we do ask for, though, is that you help us understand what totals, what comprises that grant size that you're requesting, and that you help us understand, again, the context for the work. As you think about putting together a project plan, please also keep in mind that these are mini grants for up to 1 year of funding. So we will require a final report at the end of the 1 year, and we will want to understand what you guys have learned in that time period and what progress may have been made in your community, again, during that 1 year time frame. That doesn't mean, of course, that the work can't continue for longer. We absolutely understand and hope that it does continue and move forward. But just keep in mind that when you're talking about the activities and the scope of what you're going to achieve, please help us understand what's going to be happening in that 1 year time frame. As far as the use of funds are concerned, it is for defined projects. So what that does mean is that, unfortunately, it's not for general operating support or long-term funding. When we think about these early stage opportunities, we are thinking about piloting something new, for example. It could be anything that really introduces perhaps an element of risk, because that's what we're here to support. We want you guys to be hearing and learning from community and setting the priorities and helping us understand how we can be supportive through this grant funding. When we talk about sustainability, it's not just how are you going to pay for the program going forward, it's also about how is the work going to continue. It may look and evolve and be very different from how you envisioned it at the beginning of your project. So again, that's kind of why we think about the work in terms of defined projects rather than kind of an open-ended general operating support framework. Another kind of point that we want to highlight and that we got a lot of pre-questions from participants as they were registering was around eligibility. This opportunity is open to active 501c3 nonprofits We know that, again, because many of you are focused on earlier stage work, that means that you may be in the process of getting or obtaining your 501c3 designation from the IRS. If that is the case, we unfortunately can't fund you without the 501c3 status, but what that does mean is that you could potentially use a fiscal agent to formally apply for the funds and be the grant holder should you be awarded funds. There are many different types of fiscal agents that exist. If you are curious, TSNE, Third Sector New England, has some great resources about how you can go about pursuing a relationship with a fiscal agent. Sometimes local community foundations also serve as fiscal agents, but there's many paths forward towards being able to receive funding from us, provided that it is through that 501c3 pathway. We also received a number of great questions about municipalities being eligible to apply. And we absolutely welcome the involvement of municipalities, whether it's local at the city level or at the state level in the work that you guys are doing, because we recognize that you guys are serving as key partners and collaborators. But what we would ask is, again, that you apply through a 501c3 partner. So that could be a Friends of or a type of organization to be the formal holder. And so what you will see is if you look back at any of our past grantee lists, we will sometimes indicate that X organization is serving as the fiscal agent on behalf of Y organization. So in that case, there is certainly precedent that has been set about us working with fiscal agents. We don't require any documentation to prove what the relationship looks like. We don't set any terms in saying that it has to be, this type of relationship with the fiscal agent. We really are quite flexible in that regard. As we also think about eligibility, we've gotten some great questions here too about whether or not when we refer to community and working with different partners, what we really mean. And those could be collaborations that are new or existing. We are open to reviewing proposals from both early stage grassroots efforts and those partnerships that may have been established for several years or even longer. The duration of the collaboration is not necessarily the end-all and be-all, but it is just helpful context for us, again, in understanding how the work is unfolding. And again, I think I might have mentioned this earlier, but just to reiterate, for those of you on the phone who are current Momentum Fund grantees, you are eligible to apply for a second year of funding, provided that you do, of course, fulfill the terms of the original grant and have turn to us your completed interim report, and then, of course, that you intend to share with us your final report at the end of that 1 year. When you think about applying for your second year of funding, though, it would be useful for us to understand what is different about the work this year than perhaps what you had included in your application last year. In terms of project characteristics, we are really focused on community-led efforts. This, again, is going back to one of the guiding principles that Philip had mentioned earlier about us really wanting to be engaged with community and to ensure that things aren't happening to community, but it's really the community who is coming forward with great ideas and is involved throughout the process. Efforts also have to address healthy aging or issues important to older people. We received some questions ahead of time about whether or not this grant from the Momentum Fund could be used to support intergenerational work, and that is a great question. It is an area that is eligible to apply for funding. What we would want to understand, of course, again, is that impact to the older people and how they were involved in the process. So those are kind of the two must-have project characteristics. We also have listed on your screen what preference will be given to in terms of some of the other areas that we mentioned as it relates to our guiding principles. So that means whether it's advancing promising solutions, featuring collaboration, addressing inequities, or making a community more age or dementia friendly. I just want to take one quick second to harp on the promising solutions part of the slide here. And we really want to emphasize that this is different for every community. Again, you're not going to see us put up very specific information saying that it has to include X, Y, or Z activities. These are the types of work that we hope that you will spend time understanding within your community and then share with us how your work plans to really move the momentum forward. You'll also find that we support a range of organization types, sizes, and projects. And I think the best way to really underscore this part is for Philip to actually go through a few of the grantees from last year to give a sense of what this really means.
Thank you, Kimberly. And I just want to pause to remind folks, we're getting some questions through the question feature on the right-hand panel. Feel free to add your questions to the list. We will be turning to the Q&A at the end of the presentation, and we'll answer as many of them as we can. So as Kimberly mentioned, we think the examples are probably one of the best ways to illustrate the depth of variety and kind of different thinking and different types of efforts in communities represented by the 2018 Momentum Fund grantees. So we're going to highlight just 4 out of the 27 grants that were made last year. But I just want to disclaim quickly, as a reminder, we were not funding in Connecticut last year, so there are no examples available from Connecticut for those that are interested in reading up on the grantees. And then the other is that the full list of grantees is available on our website so that you can look for yourselves in greater detail about the types of organizations and efforts that were selected by the review panels and funded by the foundation last year. But let me just turn to these 4 examples because I do think that they give you a breadth of type of organization, type of effort, and type of community. Jewish Family Services of Metro West, which is based in Framingham, Massachusetts, was funded this year in 2018 for an LGBT healthcare access project where they engaged volunteers from community to be trained as healthcare navigators to work directly with LGBT community members. And that was really intended to overcome some of the barriers to access to services that are understood to be experienced by folks in the LGBT community, also to break down some of the isolation that happens for that community that tends to have a different support structure or network for themselves individually in community. That contrasts with the grant to Quincy Asian Resources, which is based in Quincy, Massachusetts, which is just south of Boston. This innovative and promising idea for this community was to develop a series of field trips for older residents in the community of Quincy. The predominant kind of population that would be served is Asian. And the field trips were intended to do a variety of different things. They partnered with entities like the MBTA, which is our regional transit authority, to use these field trips as a way to familiarize the residents with the MBTA routes and services and supports that are available through that agency. But they were also a way to break down isolation and to get community members to understand a variety of wealth of resources that are available by taking field trips to things like the aquarium in Boston or just to other service providers in the community so that they could get a hands-on one-to-one familiarity with what's available to them in terms of services and supports. I would contrast both of those, which are in Massachusetts and in fairly suburban or urban environments, to the Grafton County Senior Citizens Council in New Hampshire, which took an existing approach to arts programming and adapted it for a population in northern New Hampshire, which is very rural. And the support to Grafton County Senior Citizens Council was for them to continue to make this programming available in an enhanced fashion for communities across the counties in northern New Hampshire. So it was adapting an existing set of programs in collaboration with a variety of organizations that already work with older adults to make sure that arts programming was available in an effective and accessible manner across a variety of organizations for older adults. And then the fourth example that we'll offer is Progreso Latino in Central Falls, Rhode Island, which also responded to a community priority around making dementia-related issues more visible and services supports more accessible in Central Falls. There, they engaged a community resident to actually serve as a backbone organizer for meetings, conversations, and a plan that was being developed ultimately for the city of Central Falls to begin to think about how to make the services and supports available to people with dementia or people caring for those with dementia, so that it was more readily available to anyone who might be looking for it or need it, how that community really cares for people with dementia. So again, 4 very different organizations working with very different populations in very different situations, all found a home within the Momentum Fund, in large part because they were working directly with community on issues that they had heard directly from the community were important to them, and were doing so in a way that was collaborative with a variety of organizations to make their communities stronger. So with those examples, and again, I encourage you to take a look on our website for more information about the grants that were made in 2018. Let's turn to the elements of the application. As Kimberly mentioned earlier, the Momentum Fund has been organized to be more accessible because we're offering mini grants, and therefore we have made the application process a little bit easier, a little bit faster, and hopefully that reduces the burden and makes it more relevant to organizations that are thinking about trying something new or are looking for a way to get some support for an idea that has really been hatched in community. The proposal is a full proposal, so there is no letter of intent required. The proposal that is due by September 19th would include a summary of the project, a brief description of how you see this aligning to the Momentum Fund's goals. So again, encourage you to take a look at the guidelines for the Momentum Fund as you think about responding to that element of the proposal. A brief description of the community served. Demographic information is helpful here, but also some of the context that you're operating in is really helpful. A need statement. So how do you know that this is a need for the community that you're intending to work with? And what voice have they had in identifying this need as a particular priority that should be addressed at this particular point in time? We also will ask about collaborations, so a sense of who you'll be working with, who your collaborators, partners might be, those that are already on board, perhaps those that you're thinking about engaging. Giving us a sense for that really does help in the review process. And then some sense of your anticipated results. Now, the word results can be very loaded. This does include things like developing a plan for taking this effort to the next level, or it could be, working with a series of or a set of partners or series of organizations to be better capable in the future of serving a particular set of needs that older people are experiencing in community, or it could be to see how a pilot might work of a particular program that's being adapted for your specific community. But just giving a sense of what you hope to kind of attain by the end of the period of activity is something that we would look for. In terms of the financial information, a project budget is required. There is a format that we will ask organizations to use. This screenshot just gives you a little bit of a sense of what's included. It's a line item budget that you can customize for yourselves. We do ask you to use this format. It's available for you to download as an Excel file from our online application system. You can then customize the lines, tell us the overall budget on the left-hand column on the left-hand side of the sheet. Next to that, you'd let us know what subset of that is being allocated to the funds being requested from Tufts Health Plan Foundation. And on the far right set of columns, give us a sense of what other resources are being brought to bear to this effort. Include there the amount being requested from Tufts Health Plan Foundation, but other committed grants, other pending grants, other kinds of in-kind supports, or other resources that may be accrued by the organization. So really, to simplify things and to summarize, we're looking for the narrative to be entered into our online application system with the categories I walked you through a moment ago. Attached to that, or included with that, also within the online system, will be your Excel budget file using this template. And then that gives us the information that we will need to then conduct the review process.
Great, thanks, Philip. And as he was talking about the elements of the proposal, you're probably wondering what exactly is the process for it. So as we mentioned earlier, there is no letter of intent or LOI that's associated with this grant opportunity. It is simply that one brief application that you can even preview by going to the handout section of your control panel of the GoToWebinar panel. There is a handout available to download. We will also be circulating a copy of the presentation and that same handout to all participants following this call, along with that brief survey that Alri had mentioned earlier. So if for whatever reason you aren't able to view the handout section of your control panel, please know that we will circulate a copy afterwards. Going back to the process slide here, though, as we mentioned, no letter of intent, just that one brief application. But because of the quick turnaround time that we are really hoping to come in here with really just about 6 weeks from the time of application to the time a decision is made, what this does mean, unfortunately, is that we don't have the opportunity to conduct site visits for every application that comes in. And so out of fairness to all applicants, we actually do not conduct any site visits. And we know that this is a great opportunity typically to introduce your organization, to share more about the work that you do and some of the key partners that are involved. And what we actually would love to let you know is that we can kind of front load that opportunity really even now before the application is due. If you want to send me an email asking to schedule time to speak about your organization and your particular project in advance, we are absolutely welcome to that opportunity. What we will not do is review full proposals or applications and give you, the line by line of what do you mean by this, what do you mean by that. But generally speaking, when you introduce your idea, Philip and I will be in a position to at least be able to share some initial thoughts about the project, maybe some questions that the reviewers may have, and really help you focus and hone in a little bit more before you go ahead and submit. What you've been hearing me allude to by saying the reviewers, by that I really mean that we have impaneled state-based review committees to help us with the allocations of these grants. We have a wonderful set of volunteers who have come forward from communities across each of the 4 states. So again, that's Massachusetts, New Hampshire, Connecticut, and Rhode Island, who are committed to reading the proposals and to providing, opportunity for some really healthy discussion amongst ourselves to be in a position to recommend which grants are ultimately going to be funded. So in case you are wondering, the state review committees are comprised of those individuals who really have a lot of local expertise, people who have been in those communities for a while, is able to share some perspective about the work, and really, again, help contextualize some of the project work that we may be seeing come through in applications to really, be putting us as a foundation in a position to go ahead and fund things. Please note that if you are interested in figuring out who is on the review committees, it is available on our website under the Momentum Fund. There is a pull down for who's volunteering their times, but please recognize that those are all individuals who are acting in their capacities as individuals. We know many of them have great relationships with organizations across different communities or maybe several organizations, but please know that they are acting in a volunteer capacity as individuals, not on behalf of those organizations. And should there be any conflicts of interest, please be rest assured that we'll be working through with the reviewers as appropriate about conflicts of interest that may arise. And then ultimately, with the advice and the recommendations of the state-based review committees, we'll be in a position to let you guys know the funding decision. What you see up on your screen now is actually the kind of screenshot of our website, tuftshealthplanfoundation.org. You will be able to see, kind of as highlighted by those marigold-colored boxes and stars, that the link to apply for for funding through the Momentum Fund is available through those specific hyperlinks. I really want to just take a moment to emphasize that our cyber grant system is very particular in terms of how grant proposals are submitted. So you need to ensure that you have clicked specifically on the Momentum Fund mini grant hyperlink to be accessing the application for the Momentum Fund. If not, you may find that you're submitting a letter of intent for a different grant program, and that hopefully will be caught by us on our back end, but we don't want to take any risks, and we don't want to miss any grant applications that may come through fall through the cracks in that manner. So please be very sure to click very specifically on that Momentum Fund mini grant link when applying for funds here. Now, once you do click on that link, you'll see what is up on your screen now, which is a screenshot of the login page. As it sounds like many of you are new to Tufts Health Plan Foundation, you will likely have to create a new account. And as indicated by the arrow at the top of your screen, there is an opportunity as a first-time user to create a login. If you are a returning grantee and simply have forgotten your password, there is a link at the bottom there to reset your password. The system is set to automatically close on the deadline date of September 19th. And again, out of fairness to all the applicants who were able to submit on time, we will not be accepting late applications. So even if that means by a day, again, we unfortunately won't be in a position to accept them. You will have to wait another year to apply for grant funding. And with that, it kind of concludes our overview here, but we do want to, as promised, leave plenty of time for questions and answers. And thank you so much to those who have already submitted your questions.
So thank you. We'll jump right into the questions so we can maximize the time we've got left here. We've gotten a few that have come in. One in particular said to ask if we can define community-led. What we mean by that can look very different community by community, but we would love to see the proposal describe how community members were included in the planning, how they're anticipated being part of the implementation of whatever is being proposed. We know that community members can add tremendous value to any effort, and so letting us know how you have consulted with, engaged with, and worked alongside them for us is critical. Another question that we've seen both in the pre-registration questions, but also again today, is to define older people. Again, here the foundation, we're not limiting it to the traditional 65 plus. We know that older people are very different across the age spectrum. So we typically tend to see proposals that include folks that are at least 50 years of age and older. But to go back to something that Kimberly mentioned earlier, intergenerational efforts should be proposed in the context of the older people that they're engaged, but obviously they would be engaging younger people as well as youth. So again, what we ask is that you let us know the population to be served and the community needs in the proposal, and we allow you some flexibility in defining that. So another question, it has to do with the 501c3 status. Again, active 501c3 organizations are required to be able to access and utilize our system. If your organization does not yet have 501c3 status from the IRS, you would need to use a fiscal agent. And there can be an organization serving as a fiscal agent to more than one proposal. This is a question that we've got in the past. We recognize that oftentimes fiscal agents are just managing the resources for the entity that's actually doing the work. And so it is possible for an organization to be a fiscal agent for more than one entity that are submitting separate proposals.
Great. There's also been a few questions that have come in about whether or not, what types of line items may be permissible in the budget section of your proposal. So again, we are not stipulating what it is that you have to apply for, but things like salaries for key staff, consultants, professional development, food for events, all of that type of line items, as is appropriate for your work, are acceptable activities to include in your proposal. Again, just make it clear to us how those funds will be used and whether or not it really helps you enable to get the work done. And that same thing goes for publicity that may be used to conduct community outreach. Very similarly, same thing goes for overhead costs. We typically do not set and say it has to be 10% overhead costs, and that's the maximum that's permissible. Within reason, understanding again how those overhead costs are helping you to achieve the project work, they are acceptable activities.
Yes. Just to elaborate a little bit on the use of funds, we have had proposals come in that provide stipends to community members. We have others that engage community members as paid either consultants or part-time staff to organizations while they're doing the work proposed in the Momentum Fund. All of those things will be considered, and depending on what you're proposing, may be very appropriate for what you're working towards.
Great. I recognize that we are coming close to the end of time here, and so out of respect for your time as well, please note that if you have submitted questions to us through the questions feature, we will respond to you separately. Again, we will also be in a position to answer other questions online through our respective emails here, which are up on the screen. So please do take the time to email either me or Philip, and we will be able to respond to you in a timely manner. Thank you so much for your time. We really do have a great respect for you guys taking the time out of your days to be able to participate. We will also include in the follow-up materials here an opportunity to participate in a capacity building opportunity for some reframing aging training. But again, we are at the top of the hour here, and so we will be bidding you adieu, but please be in contact with us should you have any further questions. Thank you.